the goal for treating our small animals as far as their cancer is concerned is oftentimes there are chemotherapies that can be done for certain cancers, namely lymphoma, mast cell tumor, transitional cell carcinoma of the bladder, and sometimes hemangiosarcomas. Other tumors that are fairly located to the mouth or skin will oftentimes be very amenable to radiation therapy. And sometimes the word chemotherapy comes along with a lot of very preconceived notions of what chemotherapy is, especially with humans. And animals, our goal is not to treat them till they are sick. Or if we are making them sick, then we have to back up and reevaluate our goal of therapy. Our goal of therapy basically is to try to extend their quality of life and make them feel good, make them happy, let them resume their normal life, and try to extend their life expectancy as much as possible. Sometimes just because we can treat certain cancers doesn't always mean that we have to or it's the right thing. Oftentimes if we elect not to treat our patients for their cancers, then we need to really focus on the quality of life, the comfort level of our pets, and their ability to eat and drink normally. Not all the time will you decide to treat a pet for cancer with chemotherapies or radiation. I've had personal pets that we've elected not to treat because the involvement of the cancer was so involved that it would not be in my pet's worthwhile as far as having good quality of life to treat. And at that point we really start to focus on their pain level, their comfort level, their appetite, and what we can do to try to make them as happy as possible given the time that we have. Oftentimes we have to come to the decision to humanely end their suffering, and everybody unfortunately with a pet has probably had to cross this bridge. And it's very difficult and there's no particular right time. Usually I use the pet's attitude, how comfortable I think they are, and finally their appetite to kind of guide me to make a decision of when it's the right time to make a decision about whether or not they've got a good quality of life or not. Then at that time, it's very imperative to work with your veterinarian, or talk with your family, and decide what and when is the best time for the four-legged member of the family and the two-legged member of the family. Because we all kind of have to work together to treat our pets, keep them happy and content as long as possible.